Welcome to the Family Dentistry of Frisco, Laser, Sedation and Implant Center, where your smile is our passion. We are a full-service, comprehensive general dental practice in the heart of Frisco, Texas. I've had 13 years of experience in dentistry and I've come across many cases, and I thought I would share some of these cases with my patients. These cases are presented in a way that patients can understand what is happening. No doubt the complexities of these cases are intricate and detailed, but for the purpose of this presentation we shall remain basic in the information we give so that you, my patients, can be more aware of what is potentially possible with your smile and what I, as your dentist, can do to hopefully restore, rejuvenate and create and maintain beautiful smiles. A gap between my teeth. The case that I'd like to discuss with you today is of a 36-year-old female who came to see me about a year and a half ago. Her chief complaint was, I have a black gap between my front teeth. She was an irregular dental attender. She had had no previous orthodontics and her medical history was non-contributory. She was otherwise fit and healthy. At presentation, her smile was like what we see in the picture today, before you. You can see that there is quite an unsightly gap which has developed between her upper two front teeth, and she does have a chip of the tooth on the upper right. Let's take a closer look at these teeth. There's that unsightly gap again. Now one wonders why this gap has appeared. On examination we found her gums to be relatively healthy everywhere else apart from in and around this gap, and especially around the tooth on the upper left. She also, as you can see, has the upper left tooth is slightly longer in appearance than the upper right tooth, and she bites on this tooth before she bites on any of her other teeth when she bites edge to edge. There's the gap. There's the chip. And here you can see a line depicting how the upper left incisor is longer than the upper right incisor. Well, first and foremost, I explained to her that this wouldn't be an easy fix. She had seen many dentists, a lot of whom had recommended root canals. Others had recommended the teeth be extracted and implants be placed. At the age of 36, I gave her an opinion based upon my findings that we should try and save this tooth if possible. Although a very difficult task, it was possible to save the tooth and to potentially regenerate the tissue between the two teeth. Here is a closer look at the teeth, and there are a few things I wanted to show you all. If you see the yellow line above the teeth, you can see that the gum lines are not quite the same or coherent on these teeth, and the red line shows that the front two teeth are not quite in the same alignment, which does affect the contact between the teeth and potentially the tissue and its level between the teeth. At the Family Dentistry of Frisco, Laser, Sedation and Implant Center, we have a CT scanner. This allows us to take an X-ray and an image around the teeth and to have a look at the gap which exists around the teeth. This is a 3D rendition of that CT scan. A CT scan is a cone beam X-ray of lots of thin slices of the teeth and the bone associated with the teeth, and this reconstruction is generated with computers to show you how everything fits together and where the bone is and how things look. Here I've magnified the area of the upper two front teeth, and you can see that there's definitely a gap between the teeth, and to make it clearer, This red arrow shows the surface of the tooth, but there's no overlying bone there. That yellow line showed the degree of bone loss on the tooth, and the other red arrow showed the void in between the teeth. So here you can see that there is a vertical bone loss and there's horizontal bone loss around this tooth. As my dental colleagues will tell you, that is very difficult to regenerate. Nonetheless, after discussions, I spoke to her about realigning the teeth, carrying out some root surface debridement, some laser periodontal treatment, and endeavouring to try and gain tissue reattachment and to try and graft some bone over the area of lost bone. This is of variable results. It's unpredictable, and she was aware of that, but she wanted to try and save her own teeth wherever possible. She knew that if she had a dental implant, after maybe 15 or 16 years, the dental implant may come across some problems. The gum line around the dental implant may be difficult to match her existing teeth. And as you could see from her smile, she had very elastic lips and it showed a large amount of gum above her teeth. And so it's very important that we got the gum profile just right around her teeth. So we carried out some cleaning. We did a bone graft. We also did a tissue graft. And thereafter, I spoke to her about realigning the teeth. She didn't want a comprehensive orthodontic solution. She was happy with her bite. She was just unhappy with the appearance of the front teeth. And so we did some cosmetic orthodontic treatment to try and realign the front teeth and stabilize her bite so that the tissue could infill and that she could have a beautiful smile rejuvenated. This is a picture of her teeth midway through orthodontic treatment. At this time she'd already had the bone graft and tissue graft, and if you look carefully between her front teeth, you can see that a tissue is not quite perfect there. It's still healing, and that can take many months to get the appearance like the adjacent tissue. We'd also restored the chips on her front teeth and given them back the natural appearance. And you can also already see that her teeth were back in alignment and things were looking a lot better than they had done at presentation. The orthodontic treatment took about 9 to 11 months, at which stage she didn't want to really carry on with her orthodontic treatment. We tried to persuade her to continue with the orthodontics and correct the other issues of the posterior bite, that she was happy. Here is a case after she came out of orthodontics immediately. You can see that she has tissue infill, that the gap has gone, she has nice aligned front teeth. All in all, a very pleasant result. Here is a magnified image of her front teeth. You may have noticed on the previous picture that she had a bit of discoloration there. We cleaned that away. You can see that we've managed to get a good papilla infill. We've got the level of the teeth just right, and might I say, I think they look fantastic. They look natural, healthy. She did a wonderful job. She cleaned her teeth. She followed her instructions. We were very proud of her. She has a very nice pink, healthy gum line, and the teeth look wonderful. This is her with her smile. As you can see, she's very happy with her smile. She's doing wonderfully well, and we've been following up with her now for about nearly 2 years now, and it was a great case. We're looking forward to seeing her as moving forward, and all in all, a great result. Once again, thank you very much for joining me for this presentation. My name is Dr. Paresh B. Patel. the Family Dentistry of Frisco, you can visit our website at www.fdfrisco.com. Family Dentistry of Frisco, Laser, Sedation and Implant Centre, where your smile is our passion.